first answer to the first question, which was prepared by the coalition. All questions will be answered within a 2-minute time frame, so keep that in mind in terms of the questions you are preparing as well. The question is, increased health care costs to employers ultimately are passed on to consumers through increased cost of their products. What is your plan to limit increases in health care costs and provide affordable solutions for employers and their employees?
Well, of course, we know that our representative, Mr. Boccieri, voted for the Obama-Pelosi health care plan, which was passed here recently. One of the problems and one of the certainties with that plan, as it was passed, is it is going to drive costs up. I have now spoken with businessman after businessman and business owner over the last year and a half, and especially since that bill was passed. I have seen increases anywhere from 28 to 69%, the most recent increase. We can do better. I stand here today to say that we need to repeal and replace that health care bill. We need to replace it with a bill that takes care of costs. 85% of the problems in health care today are costs. We have one of the greatest health care systems, but we need to be able to take care of the cost side. How do we do that? Well, look, I've been a businessman and in the healthcare profession for close to 30 years. And I can tell you the two things that occur in healthcare. Number one, we practice defensive medicine. In the healthcare business, you have to practice defensive medicine. Why is that? Because we have frivolous lawsuits out there, and we really need a comprehensive plan to address tort reform. That's one way we can bring costs down. The other way we can bring costs down is very simple: competition. Look, I'm a small businessman that has gone out and had to bid out health insurance. We need to reduce the walls right now, and we need to be able to bid health insurance out across state lines, increase competition, and be able to bring those costs down. The only thing certain in the Obama health care plan that Mr. Boccieri passed and approved is the costs are going up. Now, I do stand and say there are some issues in coverage that I agree with. We do have to take care of the safety net, and I will stand here and say that whatever plan we replace it with will take care of the safety net and at the same time reduce costs.
Thank you. I had a small business owner come up to me just recently, a woman, and she said, Congressman, I'm very concerned about this health care bill. I said, well, what are you concerned about? Are you okay with the fact that we're allowing students to stay on their parents' plan until they're 26? She said, yeah, I'm okay with that. Are you okay with the fact that we're ending pre-existing conditions for children? Like Jay Hawkins, an autistic boy here in this audience, who for the first time was able to get health care insurance last week, has his insurance card with him today. She said, no, I'm okay with that. I said, well, maybe you're not okay with the fact that small businesses are going to get a 35% tax break in 2010 and a 50% tax break in 2014. She's like, well, I'm okay with that. I guess maybe I ought to give it a chance. I think we ought to give it a chance. Now, let me just say that this position that they have taken about repealing and replacing, they have way more courage than I could ever dream of having. You see, I've flown in and out of combat zones all over the world. And I can tell you that they have more courage because they can go down right there in front of this audience and take Jay's insurance card and say, sorry, Jay, we're standing with the insurance company. We're not standing with you today. And I think that's the tragedy of this healthcare debate that we've had. The folks who are trying to confuse and disorient the public are waging $1 million campaign. Every day they spend $1 million to shake people up and to make them concerned. When the fact of the matter is that folks like Jack Hillier from Worcester here, guy who played by the rules, owned a small business, lost his business, and then had to go shop in the private market for his coverage, well, he couldn't find care because he was a diabetic. And as a result, he ended up losing his house, losing his car, because everybody knows that we're one accident, one medical emergency, one diagnosis away from bankruptcy. These folks want to turn it over to the insurance companies. I want to turn it back over to you. Everybody in this country, by the way, should have access to the same care that these gentlemen would enjoy as members of Congress.